If you like your health care plan, you can keep it, but this year it may cost you, and if you're a woman, it could cost you even more. Health care premiums in the Valley are expected to rise between 5 and 10%, but it may be higher for some.
Some of the prices have changed, and also there may be some cases where the plan that you are enrolled in currently is not offered any longer.
Larry Hanawa with Smith Reagan Insurance in San Benito says some of his female clients will have to pay more than men with the same policy.
I compared a client's identical coverage, the same exact plan number from 2014 to 15, and what we're seeing is that for the male rates, I'm seeing a very small increase. In some cases there was a small decrease, but maybe 5% plus or minus. But on the women, on the females, I've noticed so far about a 17% increase.
Hanawa explains the increased premiums are based on the claims insurance companies paid out in 2014.
This last year, they must have had more expenses, or the companies have more claims to pay out, perhaps with the female population.
But it's not just women who may pay more. It also depends on where you live.
And I would get an application from the Alamo, Donna, or like that, and it was the same amount of income, or let's say approximately, and their premium is higher.
A healthcare counselor at Nuestra Clínica del Valle in San Juan, Rachel Vargas, says she has noticed her clients who live closer to medical facilities have lower premiums.
I asked the marketplace why, and they said because we have a lot of hospitals nearby.
About 13% more people in the Rio Grande Valley are insured this year compared to 2013. But 1 in every 4 Valley residents is still uninsured. Navigator Program Director at MHP Salud, Cliff Clark, calls it the Texas coverage gap.
If someone, for example, makes too much money from Medicaid, but does not make enough money to get to that 100% of the federal poverty level, then they would indeed fall into what we refer to as the Texas coverage gap. And so those folks absolutely may go on healthcare.gov and buy a plan, but they would do so without any tax credit.
They're in between. They don't qualify for anything.
That's because 23 states, including Texas, refuse to expand Medicaid. Now 2.5 million Texans are left with few options for health care.
They're scared because they're going to be penalized. So they come in to apply, and the majority do not qualify for county indigent, for state of Texas Medicaid.
It's not that their income is too high, but too low to receive a government subsidy. To put that into perspective, a family of 4 making $33,000 a year is eligible for a tax credit of $293 every single month. That's going to give them very low premiums that are very manageable. But for a family of 4 with an income of only $23,000, while they will have dozens of plans to choose from, there's no tax credit, and those premiums are much higher. Vargas says she knows some families moving to states where they will be covered.
They're leaving the valley to get insurance, to get covered.
Technically, yes, you can get coverage, but the costs are prohibitive. So you could say that it's not accessible to you.
Xochitl Gutierrez de Nuño is one of those that falls in the coverage gap.
I thought we would all qualify, but when they gave me the information, I didn't qualify.
Xochitl and her husband would qualify for Medicaid in the states that expanded their programs, but Texas did not. For them, the cost is unaffordable.
I have to go to Reynosa.
Xochitl can buy a plan on the marketplace, but with no government subsidy.
The truth is, it's inaccessible.
Fortunately, individuals like Xochitl won't be penalized.
The downfall, of course, is that they won't have access to the coverage that they perhaps need and want, but they won't be fined on top of it.
When asked if he would accept Medicaid dollars last week, Governor-elect Greg Abbott said this.
Texans know better how to provide access to health care to our fellow Texans than do a bunch of bureaucrats in Washington, D.C.
Instead of accepting the federal government's Medicaid expansion money, Abbott says he is hopeful with a Republican-controlled Congress, the state will secure a block grant. In the meantime, the poor working class remain uninsured. Whether you renew your existing plan or switch to another one, remember to ask your healthcare provider if they are in the network so you don't have to switch doctors. In the newsroom, Brett Crandall, Action 4 News.